everyone. Welcome to today's episode of the Glow podcast. Today I have a very exciting guest here with me, Fischer from Rowe Plastic Surgery. They have offices in New York, New Jersey, and Florida as well. For those of you just joining our podcast for the first time, we are tailored marketing and we specialize in helping aesthetic clinics, dermatologists, and skincare clinics grow their business and increase their revenue. So if you have any questions or you're interested in learning more, just leave a comment or send me a direct message. So Lily, I'm so excited that you're here today to talk more about all things patient acquisition as well as patient services and learn more about you and Rowe Plastic Surgery. So if you want to kind of go ahead and introduce yourself and Rowe Plastic Surgery, that would be amazing.
Awesome. Well, thank you for having me, first of all. I love my job. I love what I do. I love this industry. So I'm really excited to be here. I'm Lily Fischer. I've been in plastics for almost 4 years now. I'm the Director of Patient Coordination at Rowe Plastic Surgery. We have several offices throughout New York City, Long Island, New Jersey, and Palm Beach, Florida. Hopefully more in coming years. You never know.
Yay!
Yeah, so I love it here. We have 4 amazing surgeons. They're all a pleasure to work with. All of my colleagues are amazing, professional, and really good at meeting people at the human level as well. So I am a big fan of my
Awesome. Yeah, no, I love that. I feel like that's so important too with your doctors, like being able to kind of talk to them in a way where they understand, because obviously our physicians and our doctors are a lot more educated than your average person. So being able to meet them where they are and use, terms that they'll understand and things like that is so important.
Mm-hmm.
And so I'm so interested. I know you said you've been there for 4 years, but what kind of is your background and what led you to coming into this industry where you're helping create a very high-end patient experience for people with this plastic surgery?
Yeah, that's a great question. It's probably not the path that a lot of people would think. I was actually a history major in college. I had a focus on American history and the Revolutionary War. Still love it. Still a big nerd about that. After school, I just needed a job, so I started working in Bloomingdale's at luxury retail. I was a stylist and a personal shopper for almost 4 years at Bloomingdale's, and then COVID hit, couldn't quite maintain the commission-based business that I needed after that. So I went to a different luxury boutique, and I worked there for about 7 months, and that's where the business manager and wife of the head surgeon here, Dr. Rowe, his wife came into shop and asked me to come work for her as soon as she left the store. So yeah, I shadowed because I was working in retail, so I had like weird days off. I was off on a Tuesday, so I came in to shadow, and I think I signed my contract by the end of that week and gave my 2 weeks. Yeah, I walked in and just knew like immediately that this was an amazing place to be. I could tell by the energy, and I think I realized pretty quickly that my favorite thing about retail, my favorite thing about being a stylist was helping people feel seen, helping people feel comfortable, and helping people feel like it was okay for them to take up space in the world, right? Like, oh my God, I feel so confident in what I'm wearing. And plastics is really at the most base level that, right? It's making sure that like when you are by yourself looking in the mirror, that you feel comfortable taking up your own space and doing it in a way that you feel reflects your inner self, right? So
yeah, for sure.
I think it just really appealed to me really quickly, and I knew nothing about medicine. I knew nothing about EMR softwares, but I knew a lot about customer service and tailored, personalized service. So it was really easy for me to transition.
Yeah, no, that's amazing. I feel like it's like 2 things that you would think are very, very different, but they do have such parallels too, with really just making people feel comfortable, whether that's, shopping or plastic surgery and things that go along with that. So if you had a patient coming to Rowe Plastic Surgery, what do you think kind of differentiates you all from like another plastic surgery office on the market? Like depending on where they're going to go, what would your experience, how do you guys differentiate yourself basically in the market?
Yeah. I mean, honestly, I just like to think we go above and beyond, above and beyond. We hold your hand through every single step of the process, whether it's a self-pay cosmetic surgery or a medically necessary surgery. So there, are common plastic surgeries that can be covered by insurance, like breast reductions and the removal of excess skin, usually from the tummy is what's covered by insurance. Afterward, like significant weight loss, which we've been seeing a lot of with these new weight loss drugs that are out on the market, right? And those weight loss prescriptions. So no matter what kind of surgery it is, we make sure that you are informed every single step of the way. I am your hype man every single day. If you come into this office, you are not leaving without at least 2 compliments.
Yeah.
I want to make sure that, any kind of surgery, any kind of medical office, even if it's elective, if you're choosing to do it, it's nerve-wracking enough. Right? You don't need me to make it more stressful for you. The last thing I want is to be that doctor's office where you walk in and the people behind the desk are a little standoffish and you don't feel comfortable asking a question and you kind of just make your appointment and pay your copay and leave. That's not what we do here.
Yeah.
Everybody here really, oh my God, it's going to sound so corny, but like we care so much. We consider all of our patients we treat them like they are our family, and I think that that's really important.
Yeah, no, it is really important because, like, there's nothing worse than going into the doctor's office and you're just, like, stressed the whole time. You're like,
you go out to the front and they're like, okay, when do you want to come in again?
yeah.
Like, no.
Yeah. And with like the rise of like AI and social media and everything, a lot of things are getting so much less personal. So I think still continuing to have a personal touch on things is very, very important, especially when you are entrusting somebody with something as important as a surgery. It makes it feel a lot better when you feel like you know them and you can trust them and things like that. So I think that is awesome. So for anyone that is looking for, the right surgeon for plastic surgery, but I feel like this could also translate to other industries as well, what advice would you give to them if they're looking for somebody to perform surgery?
Yeah. Okay. Well, I'm not gonna lie to you. A lot of it is vibe, right? A
Yeah.
lot of it is, I don't even want to say necessarily like bedside manner, because somebody could have a really good bedside manner and you still don't feel like you mesh with them, right?
Yeah.
So I guess what I mean by vibe is really that you feel like when you're in your consultation and when they're going over the surgical plan and they're talking about your goals and they're talking about how to get you to your ideal result or how close they can get you to their ideal result, right? You want to make sure that you feel like they're really understanding your needs and your wants, right? And so that's why I say vibe, because I think that a lot of surgeons, there are only so many surgical techniques that you can do for one procedure, right? So if you go to 3 different consultations, you might get 3 slightly different options. So you really have to trust your gut in terms of how well you mesh with your surgeon.
Yeah.
Does that make sense?
Yeah, no, for sure. Well, and I feel like too, what you said was really important about them understanding what you want too, because sometimes it's like, okay, like they might be like, oh, okay, you need this, but you're like, wait, no, that's not what I said, really. Exactly, So it's like you're not really understanding what I'm saying. So I understand for sure. You basically want to make sure that the treatment plan that they're recommending to you is the end result that you actually want, and also the process too is what you want, because if you're like, no, I don't want something like super invasive, but they're recommending something that is a little more invasive, so you just want to make sure that everybody's on the same page and you're communicating and vibing well.
Exactly, because that's the thing. I mean, I've heard stories from a lot of patients that, they've been to another consultation and then they come to us and they go, wow, I feel so different about this consultation. I feel so much more comfortable with this consultation. The last person just kind of told me the typical thing that happens and then left the room.
Yeah.
Right? So like, no case is a typical case, right? Everybody has their preferences. So, I've even had patients who, like, for example, nipple placement, when you're doing a breast reduction or an augmentation. I've had patients who have wanted their nipple placement to be out of the norm, right? To be maybe a little higher, a little more peaked, looking a little different, right?
Yeah.
So that's something that we set up a separate consultation for, to make sure that the doctor and the patient were on the same page and that that it was doable, feasible, and that the surgeon also thought the result would be ideal, right? Because the surgeon's not going to say, yeah, I'll do that for you, or sure, if you want it, I'll do it, but it might not turn out well. Like, that should not be,
You don't want to hear that.
You don't want to hear that. Exactly, exactly. So, um,
Yeah, no, that makes sense for sure. A little bit earlier, you kind of talked about insurance, and I'm sure as you're dealing with patients on a daily basis, you're definitely dealing with insurance as well. And so, what do you think are some gaps that people would want to know when it comes to plastic surgery and insurance? Like, what is insurance going to cover? What is it typically not going to cover? I know it varies, depending on the insurance and what you're carrying, but what are some things that you commonly see where there's misunderstandings with insurance?
That's a really great question because that happens very frequently.
Yeah, I believe it.
No, all the time. And I get it, right? Like before I started working here, I would never have known the difference between, what the surgery for the upper half of your tummy above your belly button and then the lower beneath your belly button. Those are two different things, right? I never would have known that.
Yeah.
So typically insurance will cover whatever is severely affecting your quality of life. So if you're experiencing neck, back, shoulder pain, you have grooves in your shoulders from the weight of your breasts and your bra straps over time weighing into your shoulders. Some people have scoliosis. Some people have gotten into car accidents and the weight of their breasts is really not great for their back after an accident and a spinal injury. And like a removal of excess skin after weight loss. Typically the area that they would cover there would be from the tummy, the bottom half of the tummy underneath the belly button. So that area is called your pannus. So that removal of that skin is called a paniculectomy. And that would be covered because it also causes strain on the back. It's excess weight, right? It also causes severe irritation and dermatological issues, skin issues, rashes, things like that. But they will also only cover it if it is extreme enough.
Yeah.
So the skin has to at least hit the pubic bone or lower. You have to be able to lift your skin like an apron, basically. Then, if you wanted to do the rest of the tummy, the top of the tummy, to kind of get that hourglass proportional look, that would be a cosmetic upgrade.
Okay.
Because that portion of your body does not have any effect on your physical daily well-being.
Yeah.
So yeah, I mean, it's really unfortunate, especially when you see, for example, a weight loss patient who has a lot of excess skin on their arms or their thighs, but not quite enough for insurance to consider it medically necessary, which, it's hard because every insurance also has different criteria as to what makes it medically necessary. So some insurances, if you want a breast reduction, you have to remove a certain amount of grams from each breast. Right? It has to be a big enough reduction for them to say, no, they really needed this and it was severe for them, right?
Yeah.
So yeah, it can be very difficult. It's really, I think I don't know if it's just my practice, but it's really case by case basis. It's super personalized to try to figure out what we can do, what we can't do. Like there are certain implants that have been recalled, so sometimes we can get the implant for free. Like we try to do things like that all the time to
help
ease the burden. Yeah, exactly. Like for implants, implant removal can be covered, but they will not pay for you to put your implants back in.
Yeah. No, that makes sense. I feel like it's just like you said, it's so individualized. So it's almost like if you're having some sort, like if you have weight loss and you have excess skin, then it's like you need to see kind of and talk to your insurance company basically and see what they would be willing to cover and things like that. But I feel like it's tricky too, because I'm sure there's so many people that like need it, but they don't need it according to like what the insurance does. And I'm sure if you don't have the insurance coverage for it, then it's very expensive too.
So yeah, I mean, that varies. That depends on state and surgeon and number of years of experience and all of that. Pricing in plastic surgery is very variable as well. But yeah, it really just depends on your situation. I know in my practice we do everything that we can. We will appeal until we exhaust the appeals process. So if they say no, we'll try until insurance tells us you can't try again this year.
Yeah.
Until next year.
Yeah.
So we have patients write letters. We send patients to different doctors so they can have supporting evidence and attestations to get approved for surgery. We have insurance coordinators. So every single patient with us who's going through an insurance case has somebody in our insurance department and submitting their case to insurance for them. So that's what I mean by every step of the way, we're holding your hand. Like we literally
Yeah.
have people assigned to help with our patients' cases.
Yeah, no, that makes sense. That's awesome. And currently, so what are you all working towards over there at Rowe Plastic Surgery? Like, do you have some goals kind of for like the next 6 months, 12 months? Are you expanding on services? I know you mentioned kind of expanding offices as well. So what goals right now are you working on?
Yeah, I mean, we just opened our Palm Beach office this past year. It has been going so well. I think we are right now focusing on bringing a little more of that insurance covered business to Palm Beach, as well as because there's a lot of cosmetic business in that area,
Yeah,
and we
I
love
believe it.
that too. Yeah, because I think we really want to work on striking more of a balance between the insurance and the cosmetic cases, right? We really want to just keep it coming. We want all of the experience. We want to be doing things other than breasts and tummies, right? We want to be doing faces, and we want to do facials, and we're working on expanding our laser options throughout all offices.
Awesome.
Skincare lasers and skincare options are amazing, and we're working really hard on building that business up right now. And hey, it's the perfect time to do it right now, right before the summer, right before you're going to be in the sun, because a lot of these laser treatments, you have to stay out of the sun for a little while. But yeah, now's the perfect time to do it. So
Yeah, no,
we
that's
love the fun stuff
amazing.
too, not just its insurance coverage. We love the fun stuff too. It's the filler. We love it all.
Awesome. So could you expand a little bit more on like what lasers you all have and like what patients are using them for and what they're primarily coming to you for using the lasers?
Yeah, absolutely. I mean, our favorite right now is the Halo laser by Cyton. It has several different attachments, super customizable, even safe for most melanated skin, which is really incredible because there are so many instances we've seen of lasers really scarring and harming and bow pigmenting. I'm sorry, like I'm not the medical professional. I sometimes get the terms mixed up, but messing with their pigmentation and it's really important to us as a plastic surgery practice to have capabilities for every person, no
Yeah.
matter what color skin they have. We've really been loving that laser. It has so many different functions from scar removal and regeneration to, you can do a very light skin treatment with the BBL, something that really doesn't have any downtime, or you can do something, it's called ablative, when it really gets deeper into the layers of your skin. You can do something like the Halo attachment of the laser, which, all of your dead skin comes off after a couple days, your old skin, and then your new skin regenerates underneath. So we're a really big fan of that laser, and
Yeah.
it just has so many functions. It's so customizable, and we've been seeing amazing results. Another thing that we've really been loving is it's called the Jet Peel Facial. It's not a peel. It's a concentrated stream of mist and air, and we use, we make it nice. We use nice serums on you, all that good stuff.
Yeah.
And that really helps with lymphatic drainage. So right after that facial, you look cut, clean,
Snatched.
gorgeous lines. I actually got married in October, and they gave me the works, and I did that. I also did our Aqua Gold facial,
Amazing.
which is a microneedling treatment. You're like probably a little red for a couple hours after, but after that, when the Botox and the vitamins and the serums and the hyaluronic acid all soaks into your skin, glass.
Yeah.
Glowy glass, amazing. So I think those are probably our favorites right now. Yeah. And microneedling. Always microneedling.
Yeah.
Always.
No, that's amazing. And yeah, I feel like all of those treatments too, like you all have so much to offer people. So it's like when people are coming to you, and I know you're not a part of like doing like any sort of treatment plans or like diagnoses and stuff. I know, of course, some people are coming to you with very specific needs, but if somebody's coming to you and they're like, I have just like some fine lines or, whatever, how are you deciding whether we want to do some sort of invasive treatment or something that's not as invasive?
In my practice, at least, we really believe in giving everybody every option.
Yeah.
And letting them choose, right? So we would probably give them both options. We would probably say, hey, fine lines, you can do some Botox.
Yeah.
Or they're already settling. We can also do this laser but you would have
Yeah.
this downtime, you would have to do this, you would have to do this, right? So at least for us, we always firm believers giving people every possibility and all the information that they need to make the best decision for themselves, right? Because we don't want anybody to feel pressured or forced or anything like that when it comes to choosing their own treatment plan. So
just laying out all the options kind of and being like, okay, here's what we can do, but obviously you don't have to do any of these things, or, you know, really just giving them all of the options. So yeah, I love that. And I know you are a part of obviously all of the patient satisfaction and things like that. How are you all currently acquiring patients? Is it mainly just like word of mouth, or are you running social media ads? You know, what are you doing kind of to get patients in the door?
all of the above. All of the
Yeah.
above. Yep. Social media. We are working on really upping our before and after gallery because that's really important. We have so many good results and we want to make sure that they are super easily accessible and super easy to view. You know what I mean?
Yeah.
Very friendly interface. You know what I mean? So that, and then we word of mouth, a lot of word of mouth, especially in the New York, New Jersey area. We're
Yeah.
and we also, you might see our billboards in the New York, New Jersey area. We advertise in the airport in Palm Beach, any Facebook, Instagram, everywhere that we can. And really what we advertise is not, you see a lot of billboards with a doctor's face on it, right? Come see this doctor, big celebrity doctor. Our billboards and our ads advertise that you can get plastic surgery covered by insurance when it's necessary, right? Because a lot of people don't know that. So as awesome, and I mean, our surgeons are celebrity surgeons. They're amazing, awesome surgeons. We're here to help the patient. We're not here to advertise that side.
Yeah.
You know what I mean? So
For sure.
it's a little bit of everything, and again, it's really centered and focused toward the patient experience, the patient knowledge, and the patient's result and ideal.
And I feel like that education piece is so important. So how are y'all currently educating patients? Like, obviously you said you're using the billboards, but how are you getting the word out right now that, like, hey, you can use your insurance for plastic surgery, like if the conditions are right? Like, do you think that's a piece that is kind of missing?
No, I mean, I like I said, like I was saying, I think that's the majority of our advertising is just press reduction covered by insurance, right? Because a lot of people don't know that is a possibility. And it becomes difficult when we don't work with every insurance either, right? We're an out-of-network provider, so we can't work with really any public state-sponsored Medicaid, Medicare plan.
Yeah.
And that gets really difficult because there are so many people out there who need the surgery with that insurance. So even when someone calls and we don't work with their plan, we always advise them to call their insurance, see if there's a surgeon in their network who can do the procedure for them. It is somewhat rare to find an in-network plastic surgeon. It's not that most of them are out of network commonly. But there are breast surgeons, there are people out there who can help you if you need it to be covered. I don't know if that answered your question fully, but
no, it definitely did. Yeah, I just feel like that is such an important education piece. So I wanted to see kind of how you guys were like getting it out there and stuff.
And then, we also once you have the consultation, we kind of hold off on all the nitty gritty of how you get approved and what you need and all that stuff until they've spoken to the doctor, because that's the most important part, right?
Yeah.
If you don't love the doctor, why am I even talking to you about the rest of the surgery process?
Yeah.
And we, like I said, we hold your hand throughout the entire process. So you've had the consultation with the doctor. We go over every single thing that's needed from you for insurance. We go over every single person who will be reaching out to you to finish the insurance process, and we keep you updated throughout that entire process. We're really doing it with the patients so they see how it works.
Yeah, no, such an individualized approach, like I said earlier, kind of in a world where things are getting, they're not as humanized as they used to be. So I feel like having a very human approach, especially in healthcare, is super, super important. And I love that is top of mind for you all, always, it seems like. And so I think that is all my questions. Is there anything else that you want to share about Rowe Plastic Surgery, about what you all are doing over there that people should?
Yeah, absolutely. I think that plastic surgery gets a bad rap sometimes. And I
Yeah.
can tell you that I was one of those people who was like, I don't understand why it's necessary. Why would you ever do anything to yourself? But there are so many applications where plastic surgery is so life-changing and so important and relieving to a lot of people, right? Whether it be
Yeah.
mental, whether it's that thing that you always saw on your face that always bothered you when you looked in the mirror every morning, or whether it's because you need it because of insurance, or even breast reconstruction, right? Breast reconstruction is plastic surgery, and it's incredible what we can do with the human body to help it improve itself also, right? So don't shun plastic surgery right away. There is a way to do it where you're not getting addicted or going overboard or whatever it may be. There are ways to do it that really just enhance your natural self, because that's what we aim to do here.
Yeah, no, I love that. I completely agree with you too. I feel like it's like enhancing your natural self and just making you feel better, making you look better. If you look good, you feel good. So,
Exactly, exactly. When you feel gross on a day, what do? You put on makeup to make yourself feel
yeah.
better, right? Like it's the same thing, but a little more permanent.
Yeah,
Yeah.
no, for sure. That's amazing. Well, definitely let everyone know where they can find Rowe Plastic Surgery so that they can visit the website, follow you guys on social media, all that fun stuff. And I'll also put it in the show notes too.
Awesome. So yeah, you can find us on Instagram at Rowe Plastic Surgery, ROWE Plastic Surgery, or at roweplasticsurgery.com. We also have all of our surgeons linked on our Instagram, so if you want to see their specific work, you can access it there as well.
Awesome. That is great. And like I said, I will put all that in the show notes as well. So it is easy access for everyone. And it was so great having you today, Lily. And I really, really appreciate it.
Yeah, thank you for speaking with me and reaching out. I really appreciate it. I hope you have an amazing run with this podcast.
Yeah, thank you.
No problem, my dear.